Welcome to our Wednesday training call. That's all Medicare. We talk about everything Medicare. Today, I want to go into a little bit of an AEP strategy. In addition to that, I want to talk about what your steps are that you should be doing in the home now. And then, hey, now that I'm in the home with the client, what information do I need to gather? If I can't sell them today, how do I sell them tomorrow? Stuff along those lines. So let's go ahead and let's get into it. So first things first, I want to talk about your existing book of business when it comes to AEP and that strategy. So for AEP, your clients, you need to start marketing to them now. They are your clients and they have to remain your clients. Okay. So what's important about that? How do you do that? Well, first things first, you can get on the phone with them now while you can get on the phone with them before they stop answering their phone, right? You guys listened to our Monday call from 2 Mondays ago, where on 2 Mondays ago, we talked about persistency, the stuff that you should already be doing and how to keep your clients on the books. Send out cards, taking a picture with the client while you're in the home and using that as the contact picture in their phone. So when you call, it shows up with you and them. They remember who you are, right? Saving your contact information in their phone. So that way it does pop up with whatever your name is, insurance agent, right? Or something to that effect, right? Making sure that you're sending those cards out to your clients, being prepared to work your book of business now and in today. Okay. So that's really, really important. Working your book of business. Do not let someone else do it. We were just talking about how these call centers can be hammering your clients. Okay. So if the call centers are hammering your clients, they have to now record themselves. Okay, so we know that they were just being, hey, you get them on the phone, get that red, white, and blue card. Okay, get that number. What does that mean that you need to tell your client? Hey, Miss Mary, listen, nobody from Medicare calls you. No one from Social Security calls you. They only send you letters. So if someone's calling you on the phone and they're saying they're from Medicare, it's not true. Okay, it's a scam. Don't give anyone your Medicare number, your red, white, and blue card number. Okay, that number is your Social Security number of Medicare. Okay. It's kind of like that. You don't just give your Social Security number out to anyone now, do you? You don't, especially people that call you over the phone that you don't know. But luckily, I'm here to sit down with you and go over this information. Okay. So here's the deal, Miss Mary. And this is the stuff that you need to be saying to your clients that you're sitting with right now and to your existing clients and your existing book of business. So here's the deal, Miss Mary. Any changes that come up in Medicare, I'm your guy. I'm going to be the one that's reaching out to you, that's talking to you. So don't make any changes at all. If someone calls you and they make it sound great, just remember, I work with all the companies too. Don't you think I'd be the one telling you that it's better? I can go over the different plans and the different options, and you can tell me which one you like best. We can do that. Okay. I can't talk about any plans compliantly for next year until October 1st. Okay. And we can't submit any applications until October 15th. So for the first 2 weeks, we're just doing marketing. Okay. So we're just right now, you're getting your clients prepared for AEP, guys. Okay. So that's what you're doing is you're getting them prepared for AEP. All right. So you're preparing them. Hey, just want to make sure you guys know I'm your agent. Here we are. Picture of you going out with, or your whatever your card is that you use. If it's send out cards or handwritten, whatever, it doesn't matter. Whatever you use, just make sure your picture's on it. They remember you're smiling. Okay. And start sending those cards out now to your client to maintain that book of business. Make sure they understand that there's no changes and Medicare doesn't call, Social Security doesn't call. Okay. So you're making sure those are on there, making sure that they're aware that you work with all companies. Okay. So if they want to make a change and someone's got them on the phone, just tell them to call you. Hey, you know what? Instead of being on the phone for 3 hours with someone making a change, I'll make your life 10 times easier. We'll get it done. 5-10 minutes. Problem solved. Especially because people over the phone, you may not even know, you may not even trust them. Is that right? Right. Get them to agree with you. That way, when people are calling them, they answer the phone, because they get a lot of phone calls. It's literally like 10, 15 a day, I promise you, which is why I said more volume is so important when it comes to leads. So make sure you're notating that. When it comes to Medicare, there is compliant leads that you can door knock, right? Medicare supplement agents, they know that you can go out there and door knock. You get a T65 list and you're door knocking. So the leads that we use are compliant to do that. Okay, that's what we're making sure that you can do. So you can have an appointment setter. They can dial as much as possible and get you as many appointments as possible. But we're also using a compliant door knocking lead. So make sure that you're doing that as well. When you're with clients now, you're telling them the same information now, right? So start saying that to clients now. Hey, don't make any changes during AEP. Even if you couldn't help them today, okay? And you don't say AEP, obviously, explain to them. Don't make any changes in October. You know that time of year when all the stuff comes in the mail, all those phone calls, all on TV. It's nonstop. Every commercial, it's something about get your dental, your vision, and your hearing and all that stuff, right? So stuff along those lines. We want to make sure that you're telling your clients now the same exact thing. Do not give out that red, white, and blue card number. You give out that red, white, and blue card number, that is equivalent to your social security number. You don't give that out to anyone, right? Can people make changes to your life that aren't in your best interest if you give them your social? Yep, definitely can. Same thing with your health insurance. You don't want your health insurance changed, do you? No, I like my company. Great. Make sure you don't give that number out to anyone. Hammer that point across. Medicare does not call you. Hammer that point across. Social Security does not call you. Okay. Very, very important. So we're making sure that we're well prepared for that. Let me just read through the questions real quick. Ryan asked, what's a typical close ratio? It's totally subjective to the agent. How good are you? Right? It's up to you. Some people can close at 40%. Some people can only close at 20%. So the leads themselves is pretty important, right? For the agent, just make sure you have the volume and you have enough people and you are managing that book, right? You shouldn't lose a lot of clients that are being flipped because you're doing what's in their best interest. We got the tools, we got the training, and we're going to make sure we continue to do that as we gear up for AAP that's coming up. AAP, so yeah, turnover ratio, keep that low. Let's see. So someone said if our existing clients renew, will our commission be $23 or $287 in January? You get paid as earned on commission. It's someone labeled iPhone, so I don't know who that is. So if you could just change your name so it's not iPhone, so we know who you are, that would be great. So you get paid any case that renews. You must have missed the beginning of the call here because when I pulled it up, I was showing the commission schedule that actually shows it. You get paid as earned for any of your existing clients right now that you have on the books now for 2022. Next year, it renews at $287, which is your annual rate, divided by 12. They pay you as earned, about $24 a month. So that's how much you're going to get paid on a monthly basis for any clients you currently have right now. Next year, during AAP, anything you write from October till December 7th, and even after that, right? You're not going to get paid till January. They accumulate all that money. Okay. Yes, contact your clients right now. Correct. Yeah. So you want to be getting in touch with your clients right now, as I was just saying. So definitely be doing that, guys. Absolutely. Start working your book. And even people that, they are a life insurance client of yours, you can compliantly market to them other products. You can compliantly do that. They're your existing client. Start reaching out to your book right now. Hey, I know I wasn't able to help you during Medicare. That's why during the regular season, but I told you I'd give you a call back during AAP. Start doing it now before the phones get really busy, right? Hey, I just want to make sure that we're in touch. I can schedule an appointment for you when the gates open, basically. Okay. So start getting in touch with your clients, revisiting them. Also gives you a good reason to get in front of them. Maybe they want more life insurance. Maybe you're not good at working your book of business when you should be working your book of business and they need life insurance and they need more. And when you went there, they had 3 policies with 3 different agents. And now they probably just added another policy with another agent because you don't answer your phone and you're not working your book, right? So you got to make sure you're staying on top of that, guys. All right. So that's really important. Let's go into these steps again, because I know this is something a lot of people, they get confused and all that stuff on this. So let me really hammer this home. So that way we can do that. I'm going to go ahead and start this PowerPoint. It should open up right here. All right. Steps for Medicare sales. Okay. This is very simple, right? Where do you start to begin the sales process? So steps for the sales, real easy. 1. Okay. And I'm going to go through each one, but here's the main things that you need. Red, white, and blue card. That's their Medicare card, their current health insurance card, their doctors, whatever their primary doctor is and the specialist, whatever drugs they take, prescription drugs, and their Medicare and the Medicare worksheet. Okay. We're going to walk through each one. So step 1, you get in the home, complete the scope appointment. You can do this in Sunfire for every client. What is Sunfire? Great question. It's a plan comparison tool. It's a CRM. It's an enrollment center. It's amazing. Great tool. If you don't have access to it, that means that you're probably not fully certified in order to get in there. If you are fully certified and you've been fully certified, what I need you to do is send them an email with me on it with your national producer number so we can make sure that it gets done so you can access to it immediately. Okay. So Move this to the side over here. Boom. All right. So complete the scope point. We got that. Now you're compliant. Next, step 2. What I need you to do is get their red, white, and blue card. It looks like this on the right-hand side. So that's exactly what it looks like. Red, white, and blue card. This is their card directly from Medicare. So you can see on here, it says Medicare number, right? It's got this label. It's a bunch of letters and numbers. That's their Medicare number, got their name right there. And their Part A and Part B effective date, right? Tells you when it started. So that's what you need there. It's a Medicare card. Next thing that you need over here is going to be their current health insurance card. Okay. So it's real simple. I mean, if y'all have had health insurance, you know what a health insurance card looks like. It's a plastic card. If we go back to this one, the Medicare card is a paper card. This one's a plastic card, comes directly from the health insurance company, right? Comes directly from. It's going to tell you what company it is. It's going to say the health plan. It's going to bottom right-hand corner, AARP, Medicare Advantage, PPO. How much do they pay when they go to a primary? How much do they pay when they go to a specialist? Okay. And keep in mind with doctors and medications, this is stuff you're already getting as a final expense agent. Okay. So this is already information that you're getting anyways. Insurance carriers, some of them, not all of them, but some of them ask for who their doctor is. So it's great information for y'all to have. Step 4, get their doctor's information. Where do you get it? Off the pill bottles, right? You guys already know that. Look at the pill bottle, it says the prescribing physician, and you can just ask them. So, hey, Miss Mary, who's your primary care doctor? Your PCP stands for primary care physician, primary care provider. Okay. Who's your primary care doctor? Great. Hey, do you see any specialists? Great. Okay. Start writing that stuff down. Next, prescription drugs. You take any prescription drugs? Great. Write down the names. There you go. Perfect. Really simple. Not complex at all. Step 6 there, you're going to go ahead and complete this Medicare worksheet. You don't have it. Why don't you have it? Great. Go ahead and get it. It's on my website. In order to talk to your clients, you need to actually have the information on here. Talk to the health insurance company about your clients. You're going to need some of this information that's on here anyways. That's why we always want to write it down, make sure that we have it. So that's our Medicare worksheet there. All right. Step 7, really simple, right? Help them create a Medicare.gov account, unless they already got one, right? Just it says login/create an account. So go ahead and do that. That's going to tell us what previous plans that they've had. Okay. So anyone on this call that you've sold a health insurance plan, you go to Medicare.gov, you log in, you see it. What it says is, hey, you go to view my previous plans with Miss Mary. You're looking at Miss Mary. Hey, Miss Mary, you had Humana in the past, and then you switched to XYZ health insurance company, but you had Humana for 8 years. Why'd you change? Well, someone on the phone told me that this plan was better. Oh, okay, great. Well, here's why Humana might be better than this plan comparison, all that stuff, but it gives you a little edge of how you can help them get back into the plan that they were once in, right? With the company that they once trusted and had for an extended period of time, but someone called them over the phone and flipped them, right? So that gives you a little advantage there to kind of know what they did have in the past, right? Then you go into Sunfire, really, really simple. You got all the information, just input the data, right? Top right-hand corner, medications, doctors. It tells you all the plans. That's all that it is. Input that same information into Sunfire so you have it. Step 9, enroll them in the plan. For all carriers except United Healthcare, UHC, enroll them using Sunfire, right? Where do you go for UHC? UHCjarvis.com and click Lean. That is where you'll enroll the clients, right? Here's an enrollment example from Sunfire. Step 10, complete the health assessment. So after you do that, for all carriers except United Healthcare, the health assessment is located right after the enrollment app is submitted. UHC is done right after you submit the app. Click Start HA, which is right at the end of it. So this is Revel from Humana, Humana and WellCare. That's where you're doing those. Aetna has Think Agent. When you complete an application through Sunfire, it just brings you right to it. It says, hey, start the health assessment, and then you go ahead and click it, and it's going to bring you to whatever portal that you need to do it in. But United Healthcare, they don't let us do it through there. So that's just the way that it works. So let's recap it, right? Really, really simple. I'm going to go back to the first slide just to recap this real quick and make it really easy. All I need you to do, get that red, white, and blue card, get their current health insurance card, what doctors, what drugs are you on? Basically, you're filling out the Medicare worksheet. That's it. That's all you need to start looking at these cases to see if you can put someone in a better position. Medicare card, health insurance card, what doctors you got, what drugs do you take, right? So every single plan's got a different formulary. So you need to know what drugs they're on so you can compare those drug costs. That's the reason why we're getting it. Okay. It's not like underwriting with health insurance, or not with life insurance rather. So basically these 4 things here are encompassed right here on the Medicare worksheet. That's why we have it. So notability is your friend. right? I made it a pre-fillable PDF. Actually, Scott did. He made it a pre-fillable PDF, hooked that up for us. Thank you, Scott. And now you got it. So if you're using a computer, you can just, pre-fill it in a PDF. Where do you get the information? Is like I always tell you guys, you go ahead on my website, you get it right there on my website, so you can have access to that. So you don't have the information. I know we did this last time, but I'll do it again real quick. Go to my website there. Chase also has it too. Just go ahead, you hit log in there. Let me log in with Google. Boom, I'm logged in now. Go to the Medicare agent portal. You can go to, there's different sections. Intro to Medicare. This is where you get your AHIP done with your discount. Okay, next section over here, get your Medicare worksheet. All right, start typing it in. First name or full name. You're also going to need the county. So stuff like that. So type in that information so y'all got it. Okay. And then save that information so that way you can go back and sell your clients in the future. So that's pretty much as simple as it is to sell Medicare, right? It's not hard at all. And I know people, they get confused or they try and make it more complex than what it really is. It is not difficult, right? Those are literally the 4 things you need to have for your clients. And I gave you all those different steps too, which is a video that I just created with all that stuff in it. That's recorded as well as this is recorded, that I'm going to chop and I'm going to send out to you guys so you have it as well, right? Red, white, and blue Medicare card, current health insurance card, doctors, drugs. That's it. That's all I need from you guys. As Gustavo just said, it is easier than FE. He just wrote 2 today. Gustavo loves me now. We're best friends, right? I'm helping him. I was literally on the phone with him for like 3 minutes and we locked down that sale, right? The easiest thing in the entire world. Not complex. It's the easiest business that you'll ever have. Easiest business you will ever sell in your entire life. These apps are simple. They write themselves. So with that said, if you have questions, let's go ahead and open that on up. I will tell you guys, so I want to say this again because it's really important. Sunfire. Okay. To get access to Sunfire, you have to be fully certified. If you are not certified, you can't get it. Okay. Where do you go to get the information to Sunfire? Same thing. Go to the website. You go ahead and you pull that on up. That way you have it. So Sunfire access once you're certified. If you don't have access to it, but you're certified, send them an email. I don't have control over it. I wish I did have control over it. I would knock it out really quickly. Send them an email, CC me on it, put your national producer number. Hey, I'm certified with these carriers. I got certified about 7 days ago because they get updated once a week, basically, to go ahead and see who is certified. So, hey, go ahead and just update it. If you guys could just get me access to Sunfire, that'd be great. Usually what you do is you just follow the instructions that are on my website there that just tells you, hey, it's your national producer number, hit reset password. If it's not that, try whatever email address that you used when you initially signed up for your Medicare contracting. So try those 2. NPN is what it's supposed to be, or try your email address for forgot password. If that doesn't work, then great, go ahead and send them an email and that'll be as simple as it is. So with that said, questions, who's got some questions? AEP questions, those worksheet questions, really, really simple. I want to keep it straightforward because it's the easiest sale and it's not hard. I think people make it way more complex than it needs to be. So it's really, really easy. Told you those 4 things. I'll say it again, right? Medicare, red, white, and blue card, health insurance card, doctors, drugs. That's it. It's all that you need. All that you need. Scott, what do you got for me?
Those who might be brand new, when you get the blue and white card, you might run into them giving you an old Medicare card that doesn't have the newest top number on it. And so don't let that stop you. You can actually call United Healthcare and get that number with their phone. And so you can go on from there on. But sometimes they'll pull out an old card and won't have the newest card that has the wrong number on it.
That's thank you, Scott. That is actually a really great point. So, and when he says that they don't have the right number on it, what he means is Medicare, what they did, they updated in about 2019 is the old Medicare number was their social security number with an A at the end or a W at the end if they were a widow. So what you'll see is they take out an old card and it's their social on it. They know it's their social. You don't, because you've never seen a Medicare card. You're not familiar with it, right? You look at it and you're like, oh, okay, well, this isn't the number. How do I get their number? So Scott was just saying it. You just go ahead, you call United Healthcare, producer help desk. Hey, I want to do a Medicare beneficiary, verification. I want to make sure this person's got Medicare, right? And we need to get that MBI number, Medicare beneficiary identification number, which is their Medicare number on the red, white, and blue card, right? The number I was just showing you guys before. Okay. You get that number and then you go ahead, you can write it down for them and everything. So that way they have it. Good news is if they don't have that number, no one's going to be able to sell them a plan anyway. So that kind of helps y'all, that the fact that they don't have it, but you get that information so they have it. If they need a new card, they can order it from Medicare. The number for Medicare is 1-800-Medicare. Make sure you go to medicare.gov, not medicare.com. Okay. So when you create an account for a client, it's medicare.gov, and you're going to help them create an account, log into their existing account. Keep in mind too, that these clients do not create medicare.gov accounts for themselves. Anytime that you ever see an existing account, it's always an agent that creates it. Okay. So don't ask them what their what their favorite vacation spot is, because they have no idea. They don't know what their username is. They didn't create it. Most of the time, it's just an agent that created this stuff. Just so you guys kind of know. But obviously, hey, do you know what this is? Nope. Do you know what this is? Nope. Well, then you just go ahead and you forgot password. It'll say, hey, this is going to lock the account. Not a problem. If you get let's say, for example, you get the, whatever it is, the security question, favorite vacation spot wrong. Okay. Guessed it wrong 3 times, locks the account. All you do is you click the button that says unlock account. Boom. Now you got the username. You just go ahead, you go through the process, reset the password, and then you're good to go. Then you can go ahead and you can go in there and you can view it. So Dan asked a question. He said, what if the plan they were in last year that they enrolled with someone else is still the best plan? Do you get paid if they don't change? What if the plan they were in last year that they enrolled with someone else is still the best plan? Do you get paid if they don't change? No. So they would be whoever the agent, they have to make a change in order for you to get paid. If I'm following you right. Can we re-enroll them in the same plan if it's bet? Yeah. Okay. So that's kind of the tricky thing. All right. So I'll make this clear for this question, because what people do is they'll say, hey, what I'm going to do during AP is I'm just going to flip, they're on Humana. I'm just going to flip them to WellCare. And then before the gates close, I'm going to go ahead and flip them back to Humana. Then I'm getting paid the commission. I would not recommend going around doing that all the time. First, you're going to have what's called a lot of like rapid disenrollments. Clients are just disenrolling from you. So be careful with that, is what my advice would be. I wouldn't recommend going out there and just flipping them to another one and then changing them back. But yeah, if someone was changed to WellCare and CMS approved it, they changed them to WellCare, and as the gates are closing, you change it back to Humana. Well, then you are the agent of record and you should theoretically be getting paid that commission. Rules change every year, right? So I can't guarantee that you're going to get paid, and I wouldn't recommend, just putting them in there and then changing them back. I think you guys get the point about what I'm saying. So, but yes, theoretically you should be getting paid that, but I can't guarantee it. The rules do change every year. Okay. And we do our best to make sure you guys are up to date with whatever the rule changes are, right? Just like with CMS, when they said, hey, if you're in a call center, basically you need to be recording every single conversation, because you guys are the ones that are ripping off the clients, right? You guys are the people that get their red, white, and blue card number and you don't care. And you're just putting them in a plan. They're like, that's it. They don't care. I could go to every single client's house and I could change them into another plan too. It's not the right thing to do. My closing ratio could be 100%. I can sit down with every single, I can change them into another plan, right? Give me the information. I'll change them into another plan. So with that said, that should answer Dan and Renee's question over there. So who else do we got over here? We have any other questions that anyone else wants to ask, or any other input? This year, Aetna allows you to call with the client to change agents to you. Yeah. So Daryl, I'm not 100% sure when you change the AOR, if you'll be getting paid the commission on it. So I don't know, but if you have something in writing that says that, I would love to see it, so you can email that to me. So what used to happen in the past, guys, just so okay, so that's awesome. Daryl, send that over to me so I got it. So what happened is, in the past, Humana, for example, they were one company, is they would let an agent do what's called a change of an AOR, which changing the agent of record. Okay. So Humana, this client has Humana. Okay. And their agent, they haven't heard from in a couple of years, let's say. So you used to be able just to write, a letter or fill out a form, right? An AOR, change of AOR form. And then you would become the agent of record. And now you're the one getting compensated. Now you're the one getting paid the commission. So a lot of carriers did that. And then they went away from it because, as you can imagine, everyone was just changing the AOR whenever they would get in a home, not even changing the plan. Now they're getting paid. So that's what Daryl was saying in there too. So send me that information. I'll take a look at it and I'll get that out to everyone as well, Daryl, so we can make sure that everyone knows exactly what's going on. Vanessa said, if I am working out of state and running Medicare, then a beneficiary reaches out to me a month later to enroll with me. Can I, after I leave the state, can I enroll them over the phone? Yes. So that's a good question. So with Sunfire, they're supposed to roll out the capabilities for you to be able to do a enrollment over the phone and have all that stuff. So that way you are compliant. That's supposed to be done for AEP. And I'm actually going to update everyone on that as soon as it gets done, Vanessa. So we will have that done and everything will be done compliantly for you. So we'll make sure that your base recovery, you don't have to stress about that at all, or anything along those lines. Also, you can enroll through the agent portals for all these carriers. And don't be afraid to call the carrier. Hey, if that same exact question, hey, if I'm doing this and I'm over in a different state now, what's the procedure of it, right? If it's a one-off situation, do I need to do this or what? So, don't be afraid to ask that question, but we will have everything compliant for you to make sure that when you're enrolling a client in a different state, it's actually going to give you that option. And all you're going to need to do is just follow those steps. Okay. Just follow those steps. So we'll make it really, really easy on y'all to make sure that you're enrolling those clients properly and we're not getting in trouble. The rule came out for call centers basically because they were just ripping people off. That's why the rule was implemented, just so everyone knows. So we're not, for us face-to-face agents, we're good. We don't have to worry about that because we're going out there doing the right thing. And yeah, just like all their businesses, whether it was the mortgage recession or stockbrokers, that were churning accounts, it takes a few bad apples to ruin it for everyone else. So let's make sure you're always taking care of the clients. What else we got? Can I get a Medicaid number with? Yeah, absolutely. So that's another great question. So if someone doesn't have their Medicare number, you're going to do what's called a Medicare, or not their Medicare number, but both. If they don't have their Medicare and Medicaid number, you can call the carriers and you can do what's called a Medicare and Medicaid verification check. Hey, this client doesn't have their Medicaid number. What I want to do is I want to go ahead and I want to see if they're eligible for a dual special needs plan. We're in the state of Texas, Dallas County, right? Here's the client's Medicare number. We don't have their Medicare number. Great. We still need to do a verification, get their Medicare number and the Medicaid number. Here's their social. Here's their date of birth, right? AKA the Medicare worksheet, right? Here's all this information that they need. Go ahead, you get the number, write it on down, and then you can enroll them right there. What are the questions we got here? Okay. All right. Doesn't look like we have any other questions. If you got a raise hand, feel free to do that. Unmute, whatever. It doesn't matter. I want to make sure that we answer all these questions. So just make sure, as I'm waiting for more questions coming, so just make sure, guys, you are staying on top of your book now. You're marketing heavily to your clients and staying in front of them, because if you don't, someone else will. This is open season. I know for us, it doesn't matter, at all for anyone that's selling final expense, right? We're selling Medicare all year round. So it's not like for us, it's something that's crazy and we're just going to start selling Medicare. What happens is call centers they hire massively. They pay people a small hourly rate. They own their book of business. These people don't get paid a dime of renewals. Okay. They don't own that book and they just hammer the phones for that time period. And a lot of it is not compliant, which is why rules were changed. Okay. So just make sure that you're protecting your book of business and you're staying in front of it. For me, Ryan, I would do myself. I want to do max. Like I want 70, 80 leads a week for myself personally during AEP. I want to be nonstop. I want to have so much activity that I can't work all of the leads. That's the problem. That's called a good problem. I want a good problem. I have too many leads that I can't get to, oh man, I don't think I could run 70 leads a week. Great. Awesome. I don't want you to run 70 leads a week, right? What I want you to do is write 15 apps a week for 9 weeks. That's what I want you to do. I don't care if you can't get to all 70 of them. It doesn't matter. We don't care. It's a numbers game, right? It's a numbers game. So even if you sucked and you had a 10% closing ratio, you're still writing 7 apps a week. And if you're pretty good, you got a 20% closing ratio, you're writing 14 apps a week if you're getting 70 leads. So I would recommend just whatever you can afford, max it out for this time of the year. This is a huge opportunity for many of you. I don't know how many people on this call make 20 grand a month or get one check that's a $20,000 deposit in your bank account. Just think about what 20 grand would do for you, right? Think about that, what $20,000, what that check would be and what that would do for you and for your family. One deposit, 20 grand. What would that do for you? Okay, let's say you want to go a little hard. What would $60,000 do for you? 60 grand deposit in your bank account. What would that do for you? It's a tremendous amount of money, right? So take this seriously, but you cannot for a moment slow down, and you have to be relentless. You absolutely have to be relentless this time of year. There's no, hey, I'm taking a break. I'm going to slow down for a day or a couple of days. It is, you're going out 6 days a week. You take one day off. That's fine, right? I don't mind you take a day off. But for these next 9 weeks, when the gates open, you need to be relentless, nonstop, whatever it takes. If you have to travel, travel, right? Prepare right now with your family. This is what's going to happen this time of year. I want to check for 30 grand. I need to do whatever it takes to get it, right? So that's really important. There's no max on leads. We will, if you guys want to spend 50 grand, we'll max you for 50 grand, okay, of leads, right, Chase? All right. So what other questions does anybody have for us? Get you as many leads as you want, right? If your territory can't sustain X amount of leads, that means you got to get on the road, okay? So if you got to get on the road, be prepared. Be prepared to travel and go out there and see some people, sit down with some people. So write down your goals. So that way we know what the numbers are. You tell us what number you want. You tell us how much money you want deposited in your account, and we'll tell you how many leads you need to get, right? So we need to, and we're doing it now. Everything needs to go out Friday. I have orders from a ton of people in my email right now that Chase and I are covering after this call. That's what I was intending to do this call. And then Chase and I are meeting tomorrow to go over the actual counts for agents and how many everyone's up in their leads. So I need an email tonight from every single person that wants more leads, right? Or some type of game plan. So that way we can come together and say, hey, this is what we need to do for you. So I got 30 people on this call, excluding myself. I want 30 emails if I haven't gotten your email already. Okay. If you got more questions, just feel free to reach on out to us. With that said, anyone else have any questions? If not, we will wrap it on up. I don't know if anyone has anything else they want to add. All right, y'all. Well, I appreciate everyone. I will chop this video on up as per usual. I'll send it on out. If you got questions, send me an email, text message, phone call, whatever, and we'll make it work. Have a great evening.